Hi, my name's Katherine Pettus, and I'm the Advocacy Officer for International Association for Hospice and Palliative Care, which is an organization in formal relations with official relations with WHO. We've been in official relations for quite a while, and our focal point is the Department of Medicines and Medical Products, and I work specifically on improving access to controlled medicines for palliative care. Mainly in the lower and middle income countries, because that's where most of the suffering occurs, because according to the International Narcotics Control Board, more than 75% of the world's population lives in countries with low or no access to controlled medicines, essential medicines such as morphine, for the control of pain. So this is a huge problem in terms of establishing palliative care in those countries. If providers, practitioners, healthcare teams cannot prescribe or use what we call opioids for the control of pain. There are some tremendous model programs around, particularly in Uganda and in southern India in Kerala. What's so interesting about the Uganda program and some of the surrounding countries now is that nurses can prescribe morphine and take the bottles of morphine to rural areas to their patients in really hard to reach homes, because the doctor-patient ratio is about 1 to 40,000. So that makes it impossible for doctors to be the main prescribers. So nurses can take a course which teaches them several months long just to learn to prescribe opioids correctly, and then get a certificate to be a palliative care nurse. Same innovative palliative care programs and access to controlled medicines in southern India, in Kerala, where community-based care is one of the main ways of providing palliative care. And thanks to the advocacy efforts of our partner and lifetime member of my organization, Dr. Rajagopal, there's good access now to morphine in Kerala. So one of the main obstacles to provision of controlled medicines around the world is what we call opioid phobia, which really has its roots in the colonial period and in the commercialization of opium by the British Empire, originally by the British East India Company, and then the different colonial powers which forced India to grow opium and sold it to China, and really made people afraid of addiction in a generationally cultural way in many countries. So there's tremendous fear of opioids, and many doctors and nurses went through medical school without ever learning to treat pain, to diagnose pain, or to use opioids. So they're afraid of them. Patients are afraid of them because of cultural fear of opioids, and so there's a tremendous learning curve that we need to surmount to make people realize that they have a right to pain control, that they don't have to suffer unnecessarily agony at the end of life, or even before the end of life. And what you find in many low-income countries and middle-income countries is that palliative care, where it is provided, is not used for end-of-life care. It's basically used to help patients and families get their lives back and get back to work. Because with good pain control, people can go back to work, run their businesses, spend time with their families. Otherwise, they're really just lying in agony on the floor or on a bed and unable to get up and participate in their communities. So this is one of the reasons it's so important to teach health workforces how to use opioids in a rational and balanced way that doesn't lend itself to abuse or diversion, which is what most countries are afraid of, and that allows people who need it to get access to pain relief. So we've had tremendous success through our advocacy lately. with the UN General Assembly special session on the world drug problem, where several of us were working in Vienna with the Commission on Narcotic Drugs. And then this outcome document went to the UN General Assembly, and we have a whole separate chapter now on access to controlled medicines as part of drug policy. And now the challenge is for countries and policymakers to implement the recommendations in the outcome document. That's one thing. Several human rights experts in Geneva now have said that access to pain relief for older persons, for children, for all kinds of people suffering from pain is a human right. So we have now an international legal framework for human rights, for pain relief, for drug policy that allows access to controlled medicines. Now we have to, policymakers on the ground need to make sure they have the training programs in place. It's not expensive. It's really a low-cost, low-tech kind of teaching that needs to be done, and we have the resources in all over the world to do this. We just need the political will. So I'm looking forward to this World Health Assembly, where we can promote palliative care more widely in more than 10 agenda items.